Hey everybody, Jason here with my friend Janessa. So I want to talk about hospice today. So normally when you see a live video, I'm talking about mortgages or truck and tractor pulling. But today I want to talk about hospice. So Janessa and I are in a networking group. We meet every Thursday in Vrokwa, and it's full of a room, 20, 30 professionals, including myself. Yes, I do consider myself a professional that from different industries. And death is something we don't like to talk about. End of life care is not something we like to talk about. I don't like to talk about. I don't like to go to the hospital. I don't like to go to funerals, none of that stuff. But Janessa has kind of opened my eyes. I've recently, in the last 6 months, had some of my good friends who've lost parents and different things like that. So I wanted to introduce you to Janessa, not as a sales call, but more as a friend to all of you that follow me on social media, where if you have a situation where you just want to talk to somebody, and if you're in Texas and you're watching this video, Janessa's not going to be able to help you in Texas, but she can answer questions for you, because that's really what I want to offer is value to all the people that follow me on social media. And where, again, I just really want to stress death and hospice and end of life isn't something we want to talk about, but you really make it like this is what we do and stuff like that. So could you just kind of tell everybody what you do and what's available out there and stuff?
So my role is I'm a care transition coordinator. What that means is I educate, that happens a lot. I educate the public on what hospice is, reduce some of the fears and the concerns about hospice, and help people know when they're eligible and what some of those benefits are that encompass the hospice umbrella. Right. So most people have a lot of misconceptions about hospice. They think hospice is very expensive.
And that's why I want to do this video. So, it's not going to steal the family farm.
No. So actually hospice is a Medicare benefit. I like to say this is your gift from the government. You paid your taxes. You've already earned this benefit.
And that a lot of people don't know that.
No. So if you're age 65 or older and you have a terminal prognosis, meaning if your disease takes its natural progression, you have approximately 6 months of life or less left, you are likely eligible for hospice. Anyone can make a hospice referral. So maybe mom and dad have dementia and you've noticed they've lost 10% of their body weight. They're no longer able to dress themselves. They can only say maybe 5 or 6 words, or they can say a lot of words, but they're not in a comprehensive sentence. They may be eligible for hospice. You can call, we will assess them and determine if they're eligible. We can admit the same day, and if they are eligible, we've got 48 hours to get a doctor's order for hospice. So hospice can start right away, but what that hospice benefit includes would be personal care workers coming in to help give mom or dad a bath, right. Pain management, symptom management, providing medications for comfort-based quality of life. So when you're no longer seeking treatment as an option, so if you have cancer that's metastasized and there's no longer treatment for that, hospice could be a very good option. And again, because it's that Medicare umbrella, you've already paid for this gift. Hospice, you're entitled to a 180-day benefit. The average length of stay is 17 days. So there's a whole lot of care being left on the table that we want to encourage people to use. You deserve to get that really good quality at end of life. And so our job is to help people know when they're eligible for hospice and to look for those earlier identifiers so that people can enjoy that full 180-day benefit. And so sometimes people will outlive that prognosis of 6 months, but if your diagnosis hasn't changed, you can be recertified. So sometimes you'll have a person on hospice for over a year, and that's completely okay. You're still not paying anything. And it's not like when you go to a nursing home and you have to spend out all your assets to be eligible for hospice.
Right, and that's kind of what I wanted to share with the people that follow us on social media is, because that's always the big fear, is the cost of it. I hate to say it, but
everything's money, and you've worked your butt off. You want to leave a legacy for your children. You still get to. You don't have to be in a certain income bracket to be eligible for hospice. And if you're under age 65, most private insurances will pay for hospice. If they don't, most hospices offer a plan, like a financial reduction plan, so it'll be based off of your income. And a lot of times hospice can waive the fee if you're desperately in need. So I know with the organization I work for, nobody is turned away due to failure and ability to pay. We will provide hospice services.
What are some common questions that people ask you? Like, what's the most couple common questions people call when they call you?
We'll hear, what do I need to do to get mom and dad on hospice? So again, if you've seen a decline or change in condition, you can call and we'll assess. What people don't always think about is if someone is not capable of making their own decision, POA would need to be activated. So
which
that's
is power of attorney. Yep, thank you.
And so a lot of times we'll have the children say, well, I'm their power of attorney. No, you've got a piece of paper saying you are their designated representative once 2 doctors have declared somebody incapacitated for making their own medical decisions. So if your loved one needs hospice and they're capable of signing on, POA does not need to be activated. But if they are not capable of, making medical decisions in their own best interest and they've declined, you have to get that power of attorney form activated before they can be eligible for hospice. And we see that a lot. The other thing we'll find out is people want hospice, but then all of a sudden a new treatment comes out or a new drug comes out. You can revoke hospice to seek curative treatment. We are not killing people. We hear that a lot. Well, morphine's going to kill somebody. It's not. It's just going to ease breathing, help with pain management, make people comfortable. The only goal of hospice is really focusing on quality at end of life. We aren't counting the days, we're just making them count, and we want them to be as good as possible. But if a cure comes out that you want to try, you can stop hospice, try a cure. If it doesn't work, you can always restart hospice. So it's not a one and done thing.
Great. So this isn't something you normally see me doing live broadcasts about. Normally, like I said, it's truck and tractor pulling or mortgages, but like I said, Janessa is my friend. We're in a networking group together, and I feel like there's a lot of you out there that have a friend, a family member, a coworker, somebody that possibly could use Janessa's advice. Like I said, you can call her from anywhere in the United States. She may not necessarily be able to help you in your particular state, but she can point you in the right direction. That's what I want to offer for you, because she's an awesome person. She's super nice, and she'll answer your questions for you. And hopefully that if you realize that I'm kind of like endorsing her, if you will, that she's not a bad person, right?
Well, and that's
You're not.
well, thank you. And you're not either. That's why
That's a misconception.
I love the opportunity to just be able to educate people on the resources out there. There are so many fabulous ways to ease that burden at end of life. The other thing hospice does is we're supporting the patient, but we support the entire family. So you get bereavement support for 13 months following the passing of a loved one, which if you've ever lost a loved one, it's those first, that first birthday, that first Christmas without your loved one, and then the 1-year anniversary hits. And families are really great, or friends are great at, reaching out to you for those first 3 months, and then everybody forgets about it.
Just as guilty as that.
And it's easy because we're all busy. We've all got very, encompassing lives. And if you have kids, it's even more chaotic. So to know somebody's going to reach out on the 1-year anniversary of your loved one, and when 13 months hits, and if you're still struggling, we're still there for you. Sometimes we have patients who call us who just want somebody to chat, and that's completely okay. You can also have somebody who doesn't know if they want hospice. We'll talk to them about what the pros and cons are, what their different options are, and they can choose to wait a little bit and then be ready for that decision as well. But it's having the knowledge of what's available, knowing what the myths are, knowing what the misconceptions are.
Yep.
And obviously we're not going to go into all of them today, but we do have different formularies and different pamphlets that I'm always happy to email people or, send out via snail mail that actually talks about some of the different hospice benefits. It talks about what Medicare actually looks like on hospice. It talks about what to do if you don't have access to Medicare. So if anyone, again, regardless of where you're at, I can always send out information to provide further assistance for what the hospice benefit is.
Yep. So if you have somebody in your life, or personally you think you're going to need hospice coming up, or anybody you know, please just reach out to Janessa. Just call her. Her number is scrolling across the bottom of the screen. If you maybe know of somebody, forward this video onto them, or give them Janessa's number and just give her a call. You don't have to say you saw it on Facebook. Janessa is a sweet person, and she'll answer all your questions. And nobody likes to talk about death. Nobody likes to talk about end of life, but I don't like to talk about it. But I feel like it's something we need to talk about, especially with all the COVID stuff going on and different things like that. So I think it's important to know there's a lot of options out there.
And that's something people don't realize. COVID can sometimes qualify you for hospice. You may have another comorbidity or another thing going on in your life, and when you combine it with COVID, you are now eligible for hospice. If you bounce back and recover, you can graduate from hospice. So we love when people graduate. We throw parties, it's time for cake. The other thing
I love cake.
The other thing we want to focus on is veteran recognition. So
this is important because I love veterans.
Veterans Day is coming up on November 11th. The organization I work for, we are huge proponents of supporting our military personnel. So we do the full We Honor Veteran programming. We have multiple stars with the We Honor Veterans. We do the different pinning ceremonies, but we focus on the healing at end of life, knowing the different PTSDs that may come through at end of life, making sure we're fully supporting the veteran. But the other thing people aren't aware of, Veterans are a very special group in that they can sometimes actually have either curative treatment or restorative therapy sequentially with hospice, because hospice is through Medicare. Their treatments can be through VA pay if they're service connected.
Okay.
So hospice and veteran partnerships are sometimes at one unique time where you can actually still be doing, maybe you're doing dialysis, or you're finishing out a cancer treatment, or you're doing restorative therapy so you can walk, but you're still eligible for hospice. And so we can delve into that and find out what your eligibility is. Again, when you're a veteran, you're entitled to some different benefits that not everyone's aware of.
So just like you, I didn't understand 7 of those last 50 words that she said, but that's why her number's on the bottom of the screen, and she can explain that to you. So I can't stress this enough. Janessa's my friend. I trust her. I see her every Thursday, not for hospice, but for our networking group. And she has talked about tough situations, and death is a tough situation for me to talk about. Long-term illness, stuff, what do you call it when you're terminal stuff. I don't like any of that. It makes me feel icky, but she has been able to see this. And I had one of my friends whose dad passed away 3 months ago. It started making me think that I have many friends that are watching this video or will watch this video later today or tonight or tomorrow, whenever Facebook decides to put it on your Facebook feed, your timeline, that this could be beneficial for you. And I just want you to call Janessa with questions, because everybody thinks they got some family member that knows everything, and sometimes they'll know their head from their ass. And Janessa actually does know her head from her ass, and she's cute, so that helps too. So
Double bonus.
Double bonus. So,
But again,
yeah, just wrap it up.
If we can remove the fear and the stigma from hospice and help connect
Yes,
people with these
that's the
resources.
stigma. When I hear hospice, I think death.
The thing that breaks my heart is, again, so you're entitled to this gift. Hospice utilization for the state of Wisconsin is about 40%, which means of 100 people that are eligible for hospice, only 40 of them are going on it. So 60 people are dying without any of this gift. So you're leaving a lot of care on the table that way. And then when you're entitled to 180 days and only 17 days are being used, why are we letting the government keep all of this money? Give it back to yourselves. You are entitled and you deserve really good quality care at end of life. This is a great way to help you stay in the driver's seat. You maintain control. You get to make the decisions for your care. You're in the driver's seat. We're your co-pilot. We are going to help you every step of the way so that you've got a quality of life through the end of life.
Okay, awesome. Janessa, thank you for your time.
Thank you.
Again, this isn't something I like to talk about, but I think it's something that needs to be shared. So if it's 6 months from now and you're like, oh crap, I need to talk to someone about hospice, and you remember seeing this video, and that's how things work, message me. I have Janessa's number in my cell phone number. I'll get it out to you, and she'll answer any questions you have about hospice and what's best for you. So not just to Wisconsin, she'll help you out. Like I said, she won't be able to help you in different states, like personally, but she can point you in the right direction. And that's really what you need. You need some confidence to get going from an expert. So
And the nice thing is our organization's in 8 states. So anything in the upper Midwest, we're already there. So we can actually go right to their house and meet with you.
I like it.
So
Thanks
thank
for
you so
watching,
much.
guys.